and so little was known about the virus.
While we're far from through this and many questions remain, we have learned a lot in a year. Here's some of what we know now that we didn't know then.
March 11th, 2020. After months of sounding the alarm as cases and deaths multiplied around the globe, the World Health Organization gave the situation a weighty title: pandemic.
Every sector and every individual must be involved in the fight.
Never before had one been sparked by a coronavirus.
Well, back in March, we didn't know anything pretty much, right?
From a lab at McMaster University, virologist Dr. Aaron J. Banerjee and a small team successfully isolated the COVID-19 virus to allow for critical research into how to control it. It's been an adrenaline-fueled year for him, and it's personal. His grandfather died of COVID-19.
One of the things I have in my head is moving on. Something like COVID should never happen again.
Aiding in that quest, the data, insight, and lessons from the past year.
I think the biggest achievement for science has been the vaccines. This might just be the biggest scientific achievement of my lifetime.
Vaccines can now be made in less than a year. For Dr. Susie Hoda, the medical director of infection prevention and control at the University Health Network, they've had to adapt like never before.
At this time last year, we didn't know if people could transmit the virus before they developed symptoms. The moment you found out that people can be infectious in the days just before they develop symptoms, and in fact, you can actually be asymptomatic completely and transmit to other people, it changed the game entirely.
And remember the confusion surrounding masks? The thinking has evolved. Face coverings work, combined with social distancing and obsessive hand hygiene. Virtually no one got the flu this winter. Early on, everyone was excessively cleaning surfaces, but infection specialists have come to learn fragments of the virus, while they can live on surfaces for days, are not what's most infectious to others. It's the respiratory droplets. Better to focus on washing your hands. For Ontario's Chief Medical Officer of Health, Dr. David Williams, the last year has been,
I would say, a blur.
Armed with valuable lessons learned by SARS, yet this outbreak is unprecedented.
What we thought were readily available supplies were not readily available. Why? Everybody's going after the same thing at the same time.
They overestimated the global supply chain and underestimated the extent at which a global center like Ontario is influenced by the rest of the world.
Maybe we had to move quickly at limiting and restricting right from the get-go.
What he thought would be a marathon collective effort is now an ultra-marathon.
A year later, we're reminded estimates are just that. Public health officials anticipated a mild outbreak in Ontario would see 10% of the population infected. That's nearly 1.5 million people expected to have gotten COVID-19. Our collective work has kept the number of people infected down to about 313,000.